Hi everyone, welcome back to iMumz Ask Me Anything session. Today we are back with another interesting topic. I know we have a lot of users who are in the first trimester. We have a lot of questions day to day. What are my do's and don'ts? Like even the normal things that we used to do, we start thinking: is it safe? Is it not? Is it safe to eat? Is it not? So a lot of questions and doubts in the first trimester, and that is something we have a very senior doctor to talk to you about. I'll quickly introduce him, and you can take all the liberty to ask him everything you want to know about your pregnancy journey. So, Dr. Narendra Malhotra, he is the managing director of Rainbow Hospital in Agra. He has been practicing for the past 35 years. We were just calculating now, and he's delivered more than 10,000 babies himself. And they are like the fourth generation obstetricians in Agra, and I think almost every family in Agra would have somebody born in their hospital. So a very senior doctor who's been practicing IVF, who's catering to complex pregnancies day to day, and delivering healthy babies, and giving a happy pregnancy experience. So we are very excited to listen to you, sir, today. Thank you so much for joining us, for taking out time.
Thank you. Thank you. Good evening, everyone. It's indeed a pleasure to be once again back on Ask Me Anything on iMumz app, your favorite pregnancy companion, which tells you about everything. And that is what it is. So, my 5 tips for first trimester pregnancy are: first is, if you're pregnant, congratulations, not a disease, it is a happy state. So get yourself pampered, uh, get yourself, do your tantrums, whatever. But remember, please be very active throughout pregnancy, right from the beginning, even in the first trimester. Because if you're not active, and if you're dull, and if you're sulking, you're going to have a baby just like that. So be happy, enjoy pregnancy. Pregnancy is not a disease. That is what is the first tip you all have to remember. The second is, if you miss your period, and if you have a regular menstrual cycle of 28 days to 31 days, and if you miss your period, the urine pregnancy tests, which are available in the market over the counter, can detect pregnancy even with 1 day missed period. They are so accurate. And if it comes negative, you can repeat it after 2 days. If it still comes negative, then go in to a doctor and get yourself checked why the period has been missed. So if there are 2 lines on the pregnancy kit, congratulations. And that is when you have to log on to iMumz app and start asking us there, and see your doctor as soon as possible. The first visit to a gynecologist or an obstetrician should be immediately, as soon as your pregnancy test comes positive. And this is the time your gynecologist, the third tip, may do a scan, early pregnancy ultrasound, which will be transvaginal, and to see where the pregnancy is. So, supposing it is not in the uterus, it is an ectopic pregnancy, it is a dying pregnancy, it's not growing. So, the first scan should be done as soon as possible, and with your gynecologist. You don't have to go to a specialist ultrasound clinic to do your first scan. So your gynecologist, who in the OPD usually have an ultrasound machine, will put the transvaginal probe and look and show you in the uterus where the pregnancy is. Hey, congratulations all over again. Tip number 4 is that the first detailed ultrasound scan has to be done in between 11 weeks to 13 weeks, 6 days, or 11 to 14 weeks. These 3 weeks of pregnancy are the most important weeks, because everything is forming here: the genetics, the parts, and everything. So, a good detailed ultrasound, again with the transvaginal probe vaginally, not with the abdominal probe. If your radiologist is scanning you abdominally, ask for a TVS, because that will tell you the details. So, here we do what we call as the NT-NB scan, nuchal translucency and nasal bone. And these nuchal translucency is behind the neck, and the bone of the baby develops in healthy babies. So if your baby is having some genetic problem, the nasal bone does not develop, the fluid collects behind the neck, and there are fetal heart defects which can be picked up in as early as 11 to 13 weeks. So your NT-NB scan, or what we call as a genetic scan, should be done by a specialist. Whether your gynecologist is the specialist in that, or they will refer you to some ultrasound clinic or a fetal medicine clinic which is well versed with these scans to do your NT-NB scan and give a complete reporting. Now, with this report, it also dates the pregnancy. So it confirms that your menstrual date, the last period, and the ultrasound date are corresponding with a difference of 4 or 5 days. So if the difference is 4 or 5 days, your period date remains as your date, and we calculate the expected date of delivery from your periods, 9 months and 7 days. That is it. But supposing the difference between the two is more than 7 days, then we take the ultrasound date and give you a expected date of delivery by measuring your fetus. And then, of course, in the future scans, we don't change this date. Your expected date will remain same, and the growth will depend by if the fetus is not growing well, the dates will change in the ultrasound report, but we go with the date which has been fixed in your first trimester. So that is what is about the medical help which you need in first trimester. The most important and the last and the fifth tip is that apart from being happy, you have to take a good diet. You will be puking, you will be nauseating, you will feel sleepy, you will feel dull, and you will feel like burping a lot. Now, this is happening in your body because the hormones of pregnancy, which is progesterone, is increasing, and this slows down your body. So you don't get an appetite, you're always nauseated and puking and chakkar and ghabrat and all that. And of course, you're having a lot of gastric, and you're not able to digest. So these things will happen to everyone in varying figures. If they are too much, some simple medicines will be given which will control it. If they are mild, try to control them by desi ilaj. And by desi ilaj, it means have cardamom, long, elaichi in your mouth and chew it. Have some churan, have some good quality churan. Instead of 3 big meals, split your meals into 6 meals. Have lots of fruits, have lots of leafy vegetables so you don't get constipated, and all the energy also goes into you. Drink a lot of fluids, water, juices. Now, eating fruits is better than juices because when you eat fruit, the fiber also goes. But if you drink juice, only the sugar part of the fruit goes in. So eating fruits is much, much healthier and much, much better. And then, of course, if you're feeling constipated at bedtime, a lot of curd with some isabgol. So we say that you try to do with, and the only medicine which you need in the first trimester in normal pregnancy is folic acid. And folic acid preferably should be started before 3 months before you try for a pregnancy. So when you're planning for pregnancy, a 5 milligram tablet of folic acid should be started. Rather, all girls till menopause should take a tablet of folic acid because India, the folic acid deficiency is lot. And this takes care of adolescent girl problems, pregnancy problems, reproductive health problems, and menopausal problems also. So what we tell is when you're getting engaged, the present you should get is a box of folic acid tablets. And we call it engagement pill, and start taking 5 milligrams of folic acid. So good diet, folic acid supplementation, small frequent meals, lot of desi ilaj, which is not drugs, food, and lots of fluids. Sleep whenever you want to, but be active. Do some yoga exercises, breathing exercise, do meditation, and listen to a lot of Garbh Sanskar stories and pregnancy related stories, and be happy. Be happy is the most important part, and your family also has to understand that to make you happy, and you make the family happy. Of course, do whatever work you can, because being active is very, very important. Because if you're just going to lie in bed, all your muscles will go into cramp, and you'll have a lot of backache and a lot of headaches and a lot of mood swings and everything. So be happy is the thing, and it's not a disease, it's a pregnancy. So this is briefly about what your first trimester is. First trimester is from the day of your pregnancy to about 14 weeks. And in this 14 weeks, the whole baby forms. The baby's heart starts beating at 1.5 months only. So that is when your first ultrasound the doctor will do and show you the heart beating. I'm open to any questions which you have after this brief 5 minutes, 5 tips for enjoying pregnancy as you get. So let's have the questions, start firing the questions, and let's see if we can tackle them and solve a lot of your problems.
Yes, definitely, sir. So I'll directly jump into the questions because they will have a lot to ask you. I see quite a few of them are saying, as of now, I'm not having any symptoms such as morning sickness or constipation. I'm waiting for 8 weeks to get scanned. Should I worry about it? So many of them, I think 4 or 5 of them have written कि मुझे तो कोई symptoms ही नहीं है. So is it
So if
also okay?
you are lucky because you ask the people who are having symptoms and they're just puking and puking and puking. So you're very lucky. But don't wait for 8 weeks. Get your scan done at 6 and 7 weeks also. So this is known as the viability and dating scan. So viability means that the heart is beating well, and dating means that we accurately fix your date of your pregnancy as early as possible. So get your first scan done by your gynecologist. Tell her or him to do it, and don't go to a specialist to do. The specialist scan is at 11 weeks.
Thank you, sir. Now, the next question, I think you were mentioning some home remedies. So, I think Ujwala on that lines is asking, are there any home remedies for bloating or should we take any tablet? She is 12 weeks right now.
So if you have too much of bloating, then of course you need something to empty your stomach regularly, and we can give some thing which moves your bowel. Otherwise, the home remedy is curd with isabgol at bedtime, and some probiotic drinks, lassi and all that. So probiotics are very very good in pregnancy, which will keep your stomach uh, cool down and will move your bowels regularly. Otherwise, any churan and anything good quality one, not the ones which are roadside remedies, can also be tried. And of course, herbal drinks and things like that can be tried, which are good company and good quality, or homemade drinks.
Thank you, sir. Now, somebody says, hi, sir, I have severe symptoms. I cannot do regular activities by myself. I cannot eat well. I'm worried about the symptoms and baby's growth. Please advise me.
So the symptoms will vanish by 12 weeks. Very rarely they can persist after 12 weeks, and some pregnancies very, very rarely can vomit right up throughout the pregnancy. So don't worry, it will not affect the baby. The baby will take all the food from your muscles and your fat and your all the food which you've eaten and is stored in your liver. But you have to get your stores done. So you have to eat. So if you feel vomiting, eat immediately after it. Vomit again, eat. Something will get digested, and your taste will change. You may be a good roti lover, and you will suddenly not like atta and roti. You may be a good rice eater, and you will not like rice, and you get weird smells. So you won't be able to go into the kitchen, and the smell may disturb and start a puking. So all that, everyone has different, and they have to identify their own smells and whims and tastes and eat on only that. So some people might love just eat ice cream. Some people will hate ice creams. So that will depend on how your body is responding and how your mental status is responding, and take whatever. But small frequent meals are very very important. Eating 4 parathas every day or 4 chapatis every day, no. If you cannot do it, don't do it. One biscuit every 2 hours, one protein biscuit, one piece of fruit every 2 hours is good enough in the first trimester to replenish a little bit of your stores. And of course, then if it is too much, we give you some small simple medicines, and which will take care of it.
Thank you so much, sir. Now, Ishwari says, I have diabetes and the sugar is almost 140 pp and 170 post 2 hours. I'm very scared as I am 7 weeks pregnant and I don't know how to deal with all this stress.
So diabetes has to be controlled because diabetes can cause problems in pregnancy if it is picked up early. There are two types of diabetes which happen. You are diabetic before and you get pregnant. That means pregnancy is superimposed on diabetes, which probably you are because you're 7 weeks. That means you must be diabetic before. The second type of diabetes is gestational diabetes. Gestational diabetes happens because of pregnancy on your body. So your pregnancy gives a stress to your body and the insulin level decrease and you're not able to digest the glucose and the level go up. And this is a simple test which we call as the GD, GDM test, and we do that by giving you 75 grams of anhydrous glucose and doing a post 2 hours post test, and if it is less than 140 you're normal, and if it is more than 140 you are gestational diabetes. So if you are diabetic before that, the diabetes is likely to increase with pregnancy, so your insulin dose needs to be increased. If you are on oral hypoglycemics, the oral drugs, certain oral drugs can be given in pregnancy, certain cannot. So immediately see your physician and switch over to metformin, or better switch over to insulin. So you have to get your diabetes, the fasting level less than 100 and your post 2 hours post less than 140. That is very essential for a healthy pregnancy. In early pregnancy, it can cause congenital malformation. Late pregnancies, it will cause baby to grow too much. So heavy babies, and that will cause problems in deliveries. So diabetes has to be controlled and checked regularly also.
Thank you, sir. So, Ishwari, I think there's nothing to worry about. Just keep in touch with your doctor and keep your sugar in control, right, sir? It should
Right,
be.
right.
Bhanupriya says, hello, sir. In my first trimester, I was on HCG injection weekly and progesterone tablet and folic acid. Is there any side effect in future and any issue?
So HCG injection and progesterones are given to those pregnancies which are a little high risk, so elder age or pain or they've had bleeding. Now HCG injection is given only in the first 3 months and it has to be stopped after 12 weeks of pregnancy. And what HCG acts is, HCG will not act on your pregnancy, it will act on the ovaries and the ovaries will start producing progesterone. So those women whose ovaries are weak, IVF pregnancies, elderly age, they are given HCG so that the ovaries work better. And if they don't work, you add the progesterone also to it. So every pregnancy does not need progesterone. Some pregnancies will need, and these are the best way to take progesterone is vaginally, of course. Otherwise, sustained release tablets. There were injections before which are very painful and have to be given every day, or there are an injection of progesterone once a week also. So your doctor will decide which progesterone is best for you if your pregnancy, if he or she feels your pregnancy is at a little bit of risk. Otherwise, normal pregnancies you don't need HCG or don't need, and nothing. Don't worry, they don't cause any defects in the babies.
Thank you so much, sir. Now, Deepthi wants to know. I think you were mentioning, folic acid should be gifted in the wedding. So she is already 7 weeks pregnant and has not started folic acid. So she wants to know what is to be done.
Right now, the first thing you have to take today after this has to be is a must in pregnancy. Folic acid prevents a lot of birth defects, especially spinal birth defects and neural tube defects. It is a very cheap intervention to make a pregnancy very healthy. So please start right now.
Thank you, sir. Now, Monica says, could you please tell me, is it necessary to take Alligest tablet?
Alligest is progesterone. So if your pregnancy has if your doctor is feeling that either the pregnancy may go wrong or there is some difficulty or placentation or anything or a little bit of growth, then Algest, Nicorogest, Nectogest, Naturogest, Sustain, Microgest. There are 10, 20 names of this progesterone can be taken at bedtime. Progesterone, when taken orally, will cause you a little bit of sleepiness. That is why it is taken at bedtime, and it will slow down your bowel also, so you will get a little bit more bloating. So you have to pee on a digestive, and that's why we give whenever we give progesterone, we try to give it vaginally. So Olgest tablet, natural progesterone taken vaginally. Or now we have dihydroprogesterone, which is Dufestan, Dihydrofrem, Dihydrobone, another 10, 15 types of dihydrogesterone tablets that can be taken morning, evening, and that does not have significant side effects, and it is good for the pregnancy. But all pregnancies don't need progesterone. So all pregnancy will not need all just natural progesterone. Some pregnancy where the doctor feels, then take it. It's harmless. Take it till 12 weeks and reduce the dose and take it till 24, 28 weeks again to prevent preterm births.
Thank you, sir. Now, coming to progesterone, you were just saying it may have a little bit of side effects. So, Roma is asking, after taking progesterone, she's having a little bit of blurred vision. Is this the side effect of progesterone?
Progesterone side effect is indigestion and sleepy feeling. So somnolence. So blurred vision could be because of blood pressure, pregnancy-induced hypertension, and or pregnancy-induced diabetes, which has caused retinopathy. So you better get your eyes checked up immediately. And if you have a myopic number, please start wearing glasses. You could be getting because of that. Or if you have hypertension or anything, please get your eye fundus, the back layer checked, fundoscopy we call it, and get it corrected by taking the right drug. So it could be just a weak eye which needs just specs on it.
Thank you, sir. Now, we discussed about people having extreme symptoms and then people having no symptoms at all. Now, Jyoti is somebody who has symptoms, some symptoms like evening sickness, tiredness, cravings, but at times they vanish for a day or two and it scares her. She feels, what if something is going wrong inside? So, is there something to worry about if the symptoms are not there for a couple of days in between?
So if symptoms happen, you start worrying the baby is not growing. It's not like that. So symptoms will gradually vanish and will get lesser and lesser as the pregnancy progresses. Every day morning sickness, some have evening sickness also. So for everyday morning sickness, we give them a tablet at bedtime, so they wake up fresh. And for evening sickness, we can give them any digestive or anything at around 4 o'clock, so they don't have evening sickness and the lunch is digested well, so they are hungry again. So don't worry, if symptoms start disappearing, it's a good sign. So that means you will be able to eat properly, and correct and proper nutrition will go to your baby. Don't worry.
Thank you so much, sir. Now, Kajal has a very unique question. She says, I'm really sorry for my question, but I need to ask. My husband is very dark, but I need a very fair and healthy baby. What should I do?
So there is no way to change the color of your baby, and there is no way that we can see by ultrasound and see whether you have a dark or a fair baby. It's all in the genes. If See, the baby is made by both your genes, 50% husband, 50% yours. So some of the genes which are for skin color, if the husband gets, there are some 30,000 genes, so we are not sure which one has gone into that baby. So if the skin color gene has gone to the baby will be on the darker side. If both of you have contributed equally to the skin color gene, then the baby will be medium colored like me. And if you are very fair and the baby is caught on the very fair genes from you, so it's all genetic and it cannot be predicted, it cannot be changed also. So, skin color is just superficial. It's hum kale hain to kya hua dil wale hain. Should remember that. So it is the heart and it is your thought and it is your nature which matters more than being a dark or a fair. And dark babies, dark men, and dark girls Dark men were always in mills and boons and tall, dark, handsome, and dark women are very, very sexy. The color, if they have the color, so don't worry. Whatever the color of the baby, enjoy it.
Thank you, sir. The next question is Vishnu saying, I'm 2 weeks pregnant and I feel very tired, sleepy, and there is no taste in food sometimes. So I want spicy food. Can I eat spicy food?
Oh yes, you can eat. You're not sick, so you're not sick. So enjoy whatever. Only what will happen with spicy food is that you will vomit a little bit more. But doesn't matter. Eat a lot of golgappas, vomit them out. Go and eat a masala tikki again. Vomit it out. Go and eat a masala dosa. Vomit it out. Doesn't matter. If it makes you feel good, eat it. But you will, with spicy food, you will vomit a little bit more because your digestion is slowed. But for taste change, yes, you can add black pepper. You can add lemon. Try to avoid red pepper because red chilies are very green chilies, very sharp green chilies. But for taste sake, you can have a little bit of chilies in all types of food because you're not sick and you're allowed to eat anything which you can digest. So if you can digest, go ahead and eat it.
Thank you, sir. Now, Monica says, I don't have thyroid. I did not have thyroid earlier, but after pregnancy, I have got thyroid. Will it create a problem? I'm 9 weeks pregnant.
So if you have a TSH level more than 3, your thyroid level in pregnancy in all the 3 trimesters. So first time it should be tested as soon as you detect pregnancy, and then at 20 weeks, and then again at 28 or 30 weeks in the last trimester. So thyroid levels, because of pregnancy, thyroid levels may change in some people, and we test only the TSH, the thyroid stimulating hormone. So if the thyroid stimulating hormone is high, that means more than 5, we try to give you a very less dose of thyroxine hormone, so your baby does not get mentally. So your mental development of the baby is good. Now, if you have consistently very high thyroid TSH, then the baby can develop in the abdomen thyroid disease. So it can be corrected very easily. After delivery, we do the test again. After 4 weeks, you might come back to normal if you were. And if you even remain a little high, you can always have that one small tablet every day morning, which is just natural thyroid hormone, which your body makes. And if it is not making, we have to give it. Otherwise, your body will not function. Thyroid is required for functioning of the body and keep you alert and just and mentally active, and also for mental development of the baby. So don't worry. A lot of Indians have thyroid disease. Almost 30-40% of all of us have thyroid. And just taking a small tablet, very small, early morning, is empty stomach, is the answer to it.
Thank you, sir. Divya, I hope your answer also was given by doctor. So, yeah, it was a combined question almost. Now, Shubhi says, hello, sir, 7 weeks going on and I'm having gastric problem all the time. I feel vomiting and because of stomach ache, body ache and headache starts. I feel fatigue and sleepy all the time. I think
So
any
these are
suggestion?
natural. These are natural symptoms of pregnancy. At bedtime, the doctor will prescribe you Doxinate Plus or Doxinate tablet, which will make you wake up fresher. In the morning, if you're having too much of bloating and morning sickness, indigestion, you can take any digestive syrup, Aristozyme, Betazyme, Chingfred, Maryzyme, or any enzyme syrup or capsule or tablet, or you can do desi ilaj of small frequent meals, have some adrak and chew some digestive tablets or whatever, digestive biscuits, digestive. So you this is these are normal, and this will go away by 12 weeks. So you either live with it or take very mild medicines and be happier with it. Don't say that I will not take medicine and suffer from it. So if you're suffering from it, then your body will you will not get proper nutrition. And these medicines for bloating and all are not medicines which will go to your baby. So they don't cross the placenta. So they only help you. And take a lot of fluids. Very frequently drink a lot of fluids.
Yes, thank you, sir. So, I see two questions here. I assume they are related. Why is EcoSprint tablet 5 mg given? Another question is by Parul. Is it necessary to take aspirin 75 mg? What is its purpose?
So, aspirin is given to those pregnancies who have had previous abortions. Aspirin thins your blood, so more blood goes to your uterus and your pregnancy will not fail. It is not given to all pregnancies. It is also given to those pregnancies where there is likely that the mother will develop high blood pressure in pregnancy. If she's had previous pregnancy with high blood pressure, or during her 11-week test, which is the penta marker, the marker for PIH prediction has shown very high result. So we start aspirin so that the mother does not develop blood pressure and the baby does not grow, uh, baby starts growing properly and does not become a growth retarded baby. And the correct dose for giving aspirin is not 5, not 75, it is 150 milligrams taken at bedtime, and it has to be started before the fourth month. So there is no role of starting aspirin after the fourth month. It has to be because the placenta is already formed. So it helps in increasing the blood going to the baby, and it decreases the chance of mother developing PIH, eclampsia, and the baby developing growth retardation, and it also helps to prevent abortions. So it's given only in selected pregnancies, not to all.
Thank you, sir. So, I remember you were saying that progesterone causes constipation in some people. Somebody says, I've been using progesterone and I had severe constipation issue. The doctor has now suggested to stop it. Is it okay? 8 weeks pregnant.
So progesterone, as I told you, all pregnancies don't need progesterone. So if you have a high risk pregnancy, then progesterone supplement is needed. And if it is going to be needed, then you can take any laxative. The best is curd and isabgol, the desi ilaj. Otherwise, any D-loose, loose stool, loose, so many agrol, dufalac, they come with different names. That 4 teaspoonful with 1 cup of warm milk at bedtime, or have a lot of munakka, the bhutta, the corn, and leafy vegetables to fight your constipation. If your progesterone was given just by the way and stopped, there is no problem. And if you pass the 12 weeks of 3 months of pregnancy, you can stop the progesterone easily. If you were an IVF pregnancy or a high risk pregnancy, or the progesterone can be changed to dihydrogesterone tablet from natural progesterone, which does not cause constipation. So we can change the drug also.
Thank you, sir. Now, Ria says, I'm having pain in the gum since morning. What should I do?
So you better see a dentist, because gingivitis in pregnancy or gum swelling in pregnancy is common, but you could be having a cavity or you could be having some gum infection. So if it is a cavity or a gum infection, the dentist has to see it. Otherwise, use a gum cream. Don't use brush. Do the brushing with your finger. Do a lot of betadine or vocadine gargles or warm saline gargles to reduce the swelling in your gums. And there is that gum liquids which come, soothing liquids which are given to babies when their teeth, like Zyte and all, that can be rubbed gently on the gums. But better get it checked by a dentist to see whether there is gum infection or your tooth has a cavity, or it's a loose tooth, or some food stuck in between the tooth which is causing gum pain. Otherwise, it's simple. It happens in pregnancies, and just by gargling and repeatedly and by applying some glycerine gel or something will take care of it.
Thank you so much, sir. So, now another important question is many doctors recommend not to travel during the first trimester. So, Arya is asking, is traveling safe during the first month of pregnancy?
So no doctor will say it is safe in the first and the last month. Those, if it is avoidable, please avoid it. If it is necessary, take all precautions so you don't get too many jerks. You don't eat outside food. and you don't get sick by the how wind and temperature changes and things like that. So if it is necessary with precautions, you can travel, but if it can be avoided in the first month and the last month, it's always better.
Thank you, sir. Now, Shivani says, "Hi, sir. I'm 7 weeks pregnant now, and I feel brown color discharge with 5.5 week amount of discharge. Very little. I think she means to say towards the end of the periods, that amount of discharge. Uh, in the ultrasound, we have slightly thin decidua, and in 6 weeks, 5 days, my baby heartbeat is 84, and it shows 6 weeks growth. So my question is there a serious problem? My doctor prescribed me progesterone tablet and injection and fully bed rest. So is there a big problem here?
So a little bit of discharge in pregnancy is normal, but it should not be brown or red. Brown or red means that it somewhere the placenta has not stuck properly, and there was a bleeding sometime which is not seen in ultrasound now, and that old bleeding is becoming brown in color and coming out. So that could be, that is why the doctor has given you progesterone, so your placenta, to help your placenta function well, because the placenta produces progesterone. And the other thing is your heartbeat of the baby at 6 weeks is 84. We take 90 as the normal. So a little bit slow, but nothing to worry. So that is why again probably progesterone has been added. But that is okay. See, computers are not lying on the bed 24 hours a day. So that is okay. You can walk around to the bathrooms. You can walk around to the bathrooms where that means it is modified bed rest. So don't sit with worries. So just walk a little bit, go to the bathrooms and listen to good music, sit in your drawing room a little bit, sit in your angan in the if it is winters in sunlight, if it is raining, go and watch the rain, so your mind gets diverted. But red discharge, bright red, is very worrisome. Brown discharge will get okay because it is usually implantation bleed which is still persisting, and with progesterone it should improve.
Thank you, sir. The next question Pushpa is asking, can we sleep on our stomach in the I'm 8 weeks pregnant right now?
Absolutely, yes. Till your belly bump is not showing and it's not pressing, you can. So at till 12 weeks, the pregnancy will not show on your abdomen, and you can easily sleep. After that, you will yourself find it discomfort to sleep on your bump, because it's the baby's protruding in your belly. So till 12 weeks, yes, be comfortable, sleep, and keep a pillow in between your legs also on the side, so the legs should be wide when you sleep, so that is also relaxes inside and gives. So if you sleep with legs tightly closed, then it gets constricted. So that also, if you're on your side, keep a pillow, round pillow, in between your thighs. If you're sleeping straight, keep your legs apart, any side, left or right, whichever you're comfortable, sleep on your abdomen. You're comfortable, you sleep.
Thank you, sir. Uh, Now, another important question here. Angel says, Sir, I'm 7 weeks pregnant. How to stay positive throughout pregnancy? I keep getting worried whether baby is growing fine or not.
See, getting worried will not change anything. So why worry? And so being happy will change a lot of your good hormones and your good mood. So start thinking of a good, healthy baby. Start thinking of baby names. Start talking to your baby from 12 weeks onwards. From 20 weeks, 5 months, the baby can listen to for almost 5,000 words. So be sure that no one is abusing in the house, no one is talking, no one is yelling or angry in front of you, and always has to be pleasant, because inside the abdomen the baby starts listening from 20 weeks onwards. But positive thoughts, meditation, Open up the early morning meditation TV. Open up the iMumz meditation section. Open up the Garbh stories and Garbh Sanskars and the music to relax your pregnancy, which is all available on iMumz. So listen to music, read good books, think of baby names, think how will your baby, how will you deliver? You'll deliver normally, and how much fun you'll have. Your husband will be holding your hand while delivery, and both of you will take care of the baby. You'll buy nice clothes. Think all positive. It is natural for the mind to think negative sometimes, but try to shoo away those negative thoughts as soon as they come. So mind is a very crazy part of our existence. It thinks, it just wanders, and it's very difficult to control the mind thinking only one thing. So bad thoughts, ugly thoughts, anger thoughts do come, but try to minimize them by positive thinking and positive meditation. And there, you can join any meditation course. The iMum's meditation is the best for pregnancies. Otherwise, Shivani Didi, Siri, uh, Jay Gurudev, all of them do good, very, very nice meditation and yoga courses. Join any one of them and be happy. That is the main thing.
Agreed, sir. Thank you so much for that motivation and guidance. I think very helpful for everybody. Now, Manu says, please guide us about sleeping positions for all the trimesters. I think she is in the second or third
So,
trimester.
first trimester, any way you are comfortable, you have to be comfortable. There is no fixed sleeping position. There is no fixed sleeping position. Remember that. Whichever makes you comfortable is good. Your legs should not be tightly closed. There should be a pillow in between the legs, whether you're sleeping straight, whether you're sleeping on your abdomen in the first trimester, whether you're sleeping on the right or the left. And there is no need to put a pillow under your feet. A lot of people say sleep with the feet up. The normal pillow should be taken under your head. If you are used to a hard pillow or a soft pillow, don't raise the head too much, not two, three pillows, so your neck sprain does not happen. In the second and the third trimester, it is preferable to sleep on your side, and it is preferable to sleep on the left side. Why? Because your big blood vessels, your blood from your heart goes into the arch of aorta, and the aorta is this big a vessel which supplies your whole of the body, and it is on the back of your spine, and the baby is growing here. So if you sleep straight, all the baby weight after 28 weeks falls on that aorta and will slow the blood which goes to your kidneys and to your legs. So that may cause leg cramping, that may cause swelling in the legs and all. So that, for that reason, we tell you that you turn on your left, so the weight does not fall in the major blood vessels, and your major blood vessels supply blood. So, but it is not a hard and fast rule that you sleep on your left. You can sleep on the right. Try not to sleep on your back and your abdomen in the last trimester, because that the weight of the baby will stop the blood flow, and if you sleep abdomen, then the weight, your whole weight will come to the baby and will cramp up your abdomen, and you'll be discomfort sleeping on your tummy in the third trimester. Otherwise, sleep whichever way you are comfortable and enjoy it. Put some light music and put some aromatherapy, lemongrass, burn some lemongrass, burn some kapoor in those kapoor burners, and that will relax you and give you a good, nice, sound sleep. And if you have a comforting partner, a gentle massage on your back and on your legs by a loving husband, tender loving care will make you sleep better and will increase the bondage of your pregnancy. Let your husband rub on your tummy, let your husband talk to the baby and feel the kicks. That also increases the father child bonding. You are already having a bonding with your baby because it's inside you and it's eating, but it's the partner who has also to bind. So it's a couple pregnancy. It's never a woman who's getting pregnant. It's the man also who's equally important in doing the pregnancy, and that men have to understand. And I hope some men are listening here. If they're not, we can have a special session for husbands on what the husband should be doing to their wives during pregnancy.
Definitely, sir. Actually, I was just trying to bring this up. Angel says, so good to hear from you. The whole family is listening to your advices right now. So they are all sitting together and watching. Yeah.
So that's it.
Uh, mhm.
Husbands, this 9 months, a little bit of extra care, and a whole lifetime of happiness and enjoyment for both of you.
Yes. Thank you so much, sir. Now, another important question is it okay to have intercourse in the first trimester?
So, intercourse is allowed. Intercourse is allowed, but it should not be very forceful. It should not be very dry. Try to avoid in the first month and the second month, but 3 months onwards till the last month, intercourse. But use a good lubricant, safe gel. That is very important, and no forceful pushing. So gentle intercourse in the last trimester. Some you can change positions. The sideward position of intercourse instead of missionary position would be a little bit comfortable. And if the full term does not let a penetration happen, then intercourse in between the thighs is also allowed. So because see it sexual health is an important part, and it is an important part for men also, because the sexual release has to happen to them. And if they abstain for 9 months, they might get a little irritable and worked up. So that is allowed with gentleness and with more of verbal loving care rather than a good physical or a violent physical intercourse. So good loving care is much more important than a physical intercourse.
Thank you so much, sir. Now the next question, Manu says, I'm also given EcoSprint 75 mg. I'm 31 years, 11 months old. BP is normal, and the test that you mentioned was not done. So please guide.
So you've been given aspirin empirically. First of all, the dose is less. It should have been 150, and I wish it had been started. I hope it has been started in the first trimester, because starting after 16 weeks of pregnancy is useless. Now, since you're taking it, it's better to take it till the 9 month start. It does improve the blood flow to your placenta, but it is not a drug to be given to all pregnancies. It is given only to high risk pregnancies. So if your doctor must have thought, maybe because of your age, over 30 plus, if it has been started, please keep on taking it. Don't increase the dose now. 75 is okay for you now till you start your ninth month.
Thank you, sir. Diksha says, I'm 3 weeks pregnant and I experience a thick white discharge every day. Is it harmful?
So a little bit of discharge will increase in pregnancy. But if it is thick, white, and curdy, and with itching, and with burning, and then you better get it checked and get a culture of this or a slide made from this discharge to see what. Or so you might get bacterial infection, you might get trichomonal infection, and worst in pregnancy we get more of fungal infection, candida papundi. So candid infection is more common, and that is thick, curdy, white discharge. So a candid tablet kept vaginally and a proper vaginal hygiene wash to be used, the lactic acid wash, which are now available over the counter, would be a good idea in all pregnancies. So all pregnancies hygiene. Don't wash your external genitalia with Savalon or betadine. They kill the good bacteria. We want the good bacteria in your vagina to be there, and that is lactobacillus. And for lactobacillus, wash your external genitalia or a little bit of inside by any of the lacto serum deo, or any of these pronto wash, or any be clean wash, or we clean wash. These are all available, so wash. But if it is itching and if it is foul swelling, get it tested, please.
Thank you, sir. The next question I see here is, hi, sir, due to severe stomach cramps and excessive vomiting, I was given injections. I was given Omdem injection. Is it safe for baby? I'm 8 weeks pregnant.
So when you have very severe vomiting, it is known as hyperemesis gravidarum, and you're not able to even take the medicine by mouth. The medicine by mouth early morning is also ondim mouth dissolving, which you keep under the tongue and it dissolves. It comes with different names. And if you even can't take that, then sometimes injections have to be given. They control your vomiting by working on your brain, which stops the vomiting center, which triggers the vomiting. So it's safe for the baby. It does not go to the baby. And some people can vomit so much that they even have to be given IV drips and IV food. So IV glucose line, IV isolate glucose, ringalactate with vitamins in that bottle because they're not able to take folic acid and all. So sometimes you might need 2-3 days regularly, and then you remain all right for a week, and you start puking severe again, and you again 2-3 days the doctor might prescribe some IV injections and IV. So it's if required, it has to be taken because we don't want you to get sick by vomiting.
Thank you, sir. So the next question here, is there any suggestion for first trimester to ensure that there's a normal delivery?
So first trimester cannot predict your normal delivery because the normal delivery happens if you are good in size, if your pelvic bone is wide enough, because the baby's head is about 9.5 centimeters across. So your pelvic opening, which is like this, should be across 9.5. So that can be assessed by doing the four knuckle test on your external genitalia. So your four knuckle test, if it fits into between those two bones in your pelvis, that will tell you that the pelvis is adequate from outside. But inside we cannot till your ninth month starts or till the end. And then we do a PV examination, see your inside bone is not tight, your inside bones are not tight, and the head of the baby has come into the pelvis. So and there are no exercises to be done in the first trimester for normal delivery. The only thing which you can do in the first trimester is think positive. Be positive to yourself. If you are good, nice build, if you're not very short statured, if you're not very obese, and if you're not very thin, skinny, then you will have a normal delivery because your bones are normal. Or if your baby grows too much, grows more than 3.5 kilos or 4 kilos, and you are a little bit diabetic, then only we can predict that you might not have a normal delivery early in pregnancy. Otherwise, we cannot predict. And 80% of women will have a normal delivery. Then the cesarean will happen only if the baby is in breech, if your bone is too short, if your BP is too high, if you're diabetic, if you're twins and they're getting entangled inside, and so forth. So there is a criteria for us doctors, which is known as Robinson criteria, and we take it and evaluate in the third trimester whether you're going to have a normal delivery or not. So normal delivery exercises have to start in the third trimester. Your pelvic loosening bone, and the best is squatting. Squat on the ground, and like they do pocha, you do pocha. Not for cleaning, just for exercise. Walk on the squatting position 1 or 2 rounds every 3 or 4 hours in one of your rooms. That's it. Otherwise, there are fancy delivery exercises which everyone will tell you. You can read books, you can read pregnancy care books. We've also written some pregnancy care books. You can contact us, we can send you those. And of course, iMumz tells you all the delivery exercise. Before that, in the first and second trimester, it is just here. I am going to deliver normally. I am normal. My child will be healthy. I am very happy. Affirmations every day. My child will be very intelligent. My child will be very good. I'm going to have a very lovely child, and it's going to come out normally. So start talking to yourself. Have positive affirmations. You will deliver normally.
So beautiful, sir. The next question, Purnima says, I've been facing constipation issues in the beginning and the doctor prescribed a syrup, but I'm still facing a lot of issues to pass stool. I have to put a lot of pressure for it. What do you suggest?
So constipation, as I told you, you have to take the syrup. There is green leafy vegetables, munakka, corn, spinach, all the lot of drink lot of water, warm milk with at bedtime, and curd with isabgol at bedtime. All these things will take care. Constipation is a problem to someone in pregnancies, and sometimes it can go up to even 5 months of pregnancy or 6 months, and sometimes even throughout pregnancy. So that desi ilaj plus some medicines. So you have to fight it out by taking the right proper diet and hydrating yourself well, having a lot of warm milk, curd and isabgol, munakkas. You can just fork what it is known as. It's known as fox nuts. Fox nuts can be fried or this thing and keep on chewing them so that your bowel moves well.
Thank you so much, sir. Lavina says, I have fever since yesterday. Can I take medicine? Please suggest.
So in fever, paracetamol crocin is safe and can be taken 3 times a day, 500 milligram. But we have to know why your fever is, especially this time. So we have to keep COVID in mind. We have to keep dengue in mind. We have to keep malaria in mind, and we have to keep all the intestinal diseases in mind. These are the 4 or 5 diseases, and of course the common cold and influenza. So these are the 5 things which get fever in this season, August, September. So please get yourself, if it does not come down with crocin, please get yourself tested and go to your doctor and get the correct antibiotic and the correct diagnosis done. If you're not had fever, so you must take a vaccine to prevent influenza or H1 or swine flu. The vaccine is available every year in the month of August, September. A new vaccine comes, a new strain. Take that. And if you have not been vaccinated for COVID, please take the COVID vaccine as soon as possible tomorrow, because if the third wave comes, then it is going to be very, very dangerous for pregnant women and young children. So please get yourself vaccinated. These are 2 diseases which cause fever, which can be prevented by vaccination.
Thank you so much, sir. Now, the next question is, I get headaches at least once a week. How to manage it? Is it okay to take paracetamol?
So headache during pregnancy. Previously, if you were having a migraine headaches, it can get aggravated. Sometimes it gets aggravated if you are empty stomach or have vomited too much. Sometimes it gets aggravated if your blood pressure fluctuates. Sometimes it gets aggravated if you have weak eyes and are not wearing your specs regularly in pregnancy. So taking paracetamol once a while for headache, and if it relieves it, is absolutely safe, no problem. Try massaging your head with oil or this thing. Try applying some local balm on your forehead or in your neck. Abnormal postures also can give you headaches and all. So these mild pregnancy headaches can be taken care of. If the headache is persisting and not going, then it needs to be tested and checked.
Thank you, sir. The next question is it normal to have abdominal pain throughout the first trimester?
So, abdominal heaviness, yes, because your uterus has never gone pregnant and it is increasing in size. So, it is pulling on the nerves. So, your lower abdomen may have heaviness. And because of your intestines working slow, you might have some cramps, intestinal cramps, which come for 2 3 minutes and go away with the passage of gas and all that. So only heaviness in these types, but you're having persistent severe pain and you have to bend down and grimace and all that, then you better get yourself checked. It could be the pregnancy has caused the placenta is abrupted, your cervix is short, or something else is there. Maybe you have a fibroid with pregnancy, maybe you have an ovarian cyst with pregnancy, which is causing abdominal pain. So then an ultrasound checkup is very, very important, and accordingly the treatment will be given.
Thank you so much, sir, for that session. And the users are so grateful because, as usual, your answers are so easy to understand, and uh, including home remedies and just trying to simplify things. And I think that is what everybody loves about you. So, thank you so much, all our viewers. Today, we've taken almost all the questions. Sir has answered them like a rapid fire. So, if we missed out any of your questions, you should be able to find it in this session, or you can go check it in the feed section or post your question in the feed section. One of our experts will revert to you within 24 hours. And sir, thank you so much for doing this session with us. Thank you so much for taking our time. We would really love to have more sessions with you, and somebody saying husband session is definitely needed. So maybe we could plan once.
Yeah, yeah, definitely. There's definitely a husband session and a mother-in-law session should be needed.
Definitely. Any closing lines for them, sir?
So the closing line again is enjoy pregnancy. It's not a disease. Enjoy it to your fullest. Pamper yourself. Let others pamper you, but be active. Don't just lie in bed and say I'm sick. So you're not sick. So you're not sick. That is the first thing about pregnancy you have to know. And do the right things in pregnancy, which are very simple to do, and there is nothing complex, and you will have a healthy baby and be a healthy mother. So enjoy yourself. Enjoy pregnancy. That is my punchline.
Thank you so much, sir, and thank you, viewers. We will see you in the next session. Have a great evening.
Bye.